Now, people in 26 countries say the overall cost of food, goods and services has increased since the coronavirus outbreak hit. A study conducted by Ipsos found that 3 out of 5 people say that their costs have increased either moderately or a lot. This was the finding of an online poll that was conducted on nearly 18,000 people, and the poll ran from the 22nd of May until the 5th of June. Now, for more on this, I'm joined by Ezethu Mandlelize, the Service Line Manager for Public Affairs at Ipsos South Africa. Very good afternoon to you, and thank you for your time. Now, quite a survey that you had put together, and the spectrum of what you asked the respondents was quite huge. You asked them about utilities, you asked them about healthcare, you asked them about food and a myriad of other things. But from their responses, what are the services or the consumables that actually increased over this time?
In terms of the costs that have increased during the coronavirus outbreak, the study found that people are now spending more, online South Africans to be precise, are now spending more on food, other household supplies, as well as, on their utility bills. But one would have expected them to sort of spend more in terms of medical supplies, especially because we are now faced with a global pandemic. But unlike other countries surveyed, online South Africans seem to be spending less on medical items, but are spending more on groceries and other necessities that they require in their households.
And what have been the reasons behind the increases in food specifically, as well as the other household items?
I think one can just attribute this increase to the disruptions in supply chains when it comes to this pandemic, because I think this study findings are adding more weight in terms of other reports around how disruptions in supply chain have sort of affected food prices. But when we asked people in this survey in terms of why they think they're spending more when it comes to food items, they mentioned that during the coronavirus outbreak and also the lockdown, they are spending more money on expensive items, and also just the costs that are related with food delivery or other items because of store closures, and the fact that people now are trying to avoid to go out in public, and they're also trying to avoid things like long queues in grocery stores, and some people prefer to actually shop maybe online. And these delivery costs that are now added to these items are causing people to feel like they are spending more on these items, apart from the fact that things have generally gone down in terms of prices because of issues that have been cited in many other publications, such as the disruptions in supply chains, especially when it comes to stable items like eggs and milk and other items.
I don't know if this is something that you covered within your study, but one would expect, or at least would assume, that healthcare would be a priority for South Africans during this time. What are the reasons perhaps that were given for not buying medication and other healthcare-related products?
The study did not really go into more detail, or maybe just to reveal why people are not spending a lot when it comes to healthcare. But I think if one can just look at South Africa in general, and also the public health system in South Africa, and the free availability of certain medical supplies or medical necessities, one could sort of attribute that less spending on medical items to the public healthcare system itself. But I think also what can make people to spend more money on food items is the fact that people are now working from home, and this was cited in the study findings, that because people are working from home, household utilities seem to be on an incline as opposed to just spending on medical items. So I think people can access these medical services freely from the public health system, and therefore there isn't any need for them to sort of spend quite large sums on money on medical items. But with food and other things, on the other hand, they definitely still need to pay for these out of their own pockets. Hence, they are feeling, the strain in terms of their income.
Now, Ezethu, there is the issue of unemployment in the country. Many have been retrenched, and there's instability and uncertainty around that. Has that in any way affected their spending patterns, and how have South Africans been able to survive?
Well, the study also does not reveal in terms of how they are surviving during this time. But what I can say from the findings is that, this hike in food prices seems to be, affecting the older segment of the population, and especially women more than their male counterparts. And I think also, if one can just look into detail in terms of what's happening in the country with regards to jobs and, retrenchments and cut salaries during the COVID-19 pandemic, one can sort of see that, people are taking a strain, and the fact that they're concerned about these food increases also shows that they don't feel confident enough in terms of the ability of their income to sustain them during this process. And I think one could also link to this study findings to what's happening, and also come to the conclusion that because people are no longer confident about their ability to keep their jobs, and also that because they're not getting their full salaries, they're feeling this hard knock in terms of being able to pay for certain food necessities. So I think really their income is affected, and therefore they cannot afford basic necessities like they usually would in a normal circumstance.
Utilities are also those monthly, spending items that one has to spend on. There's water, telephone bills, etc. How did those fare in your study?
People are actually spending more during the pandemic on these, and I think, like I said before, one can attribute this to people now spending more time at home, and also people working from home. And because they've had to work from home during the pandemic, and the different levels of the lockdown, they've sort of experienced increases in terms of the amounts that they pay towards utility bills. And I think also what could be making people to start noticing, this increase in food items is because they are now at home. Children were also at home for some families during the lockdown, and hence the number of food necessities that they need, or the quantity of food rather, and also has also sort of like increased as opposed to how it would have been if people were working from their home or from their offices for that matter. So I think really also being at home has, although it has been, a good safety measure in terms of people, observing social distancing and keeping safe, but there's also that concern of how do they now maintain their living, and how do they effectively work from home with these increasing prices.
And as far as insurances are concerned, and perhaps bond repayments, where do those feature?
When it comes to insurances and bond payments, and also other, household expenditure, the participants of the study are less concerned about these. And in South Africa in particular, a large majority of people feel that these have remained the same, and they are not paying more when it comes to these. So the only concern at the top of the list, especially when it comes to online South Africans, is, household necessities such as food and other supplies, and your utility bills. But in terms of other things like insurance and rental or even bond, these are less of a concern, and they seem to have remained stable during the pandemic.
I know there was an extended period of time where all South Africans were pretty much at home and were not able to travel. But once the travel restrictions were lifted, where did transport fare within your survey?
Well, within this particular survey, there wasn't any coverage in terms of the transport fare, and I definitely think that that's something that's worth exploring and covering in future studies. But at this point in time, we have not covered that, unfortunately.
All right. Well, Ezethu, we'll leave it at that for this afternoon. A very interesting study there done by Ipsos, a global study, and Ezethu talking to us about South Africans' spending patterns and what South Africans deem to be most important. And you could see there from that study that food right on top of the list, followed by, paying of utility bills and phone bills, etc. But healthcare right there at the bottom, and personal care also.